This is a one case, one pearl series. Here, the anterior image shows the right and left eye with a spirophakic lens, but with a difference. So what is the difference? In the right eye, the pupil size is normal and the aqueous depth is decent. But in the left eye, you can see that it is a spirophakic lens. The pupil is dilated. Because of the post-trabeculectomy, patient was given atropine. So the lens has moved forwards, touching the posterior surface of the cornea. So avoid any dilating drops. It can be atropine, cyclopentolate, pomade, or tropicamide. But it is important that you avoid the dilating drops in a microspirophakic patients. Thank you. Hope it is useful for you.